Hello, my name is Dr. Brian Petrie. I would like to welcome everybody to this webinar presentation on dementia and Alzheimer's disease, their early warning signs, and what you can do about it. If you are interested in taking notes during this presentation and would like a copy of the slides that I'm using to write on, just pause the video and hit the download link below. Before we get started, a little bit about myself. I am a doctor of chiropractic and have been in private practice for 30 years. The focus of my clinic has been in functional medicine as well as functional neurology. I am a graduate of the Barlow Brain and Body Institute, as well as an ongoing student of the Karazian Institute, which educates healthcare professionals in the most recent science-based functional medicine approaches to improve the lives of our patients suffering from the rising chronic health conditions we are facing today, such as with dementia and Alzheimer's disease. I am also the Amazon best-selling author for my book, Your Health, Your Life, Your Responsibility: Why Insurance and Traditional Medicine Can't Save You. Before we get started, I would just like to tell this story about Tony Meadows, because this is the problem we see with Alzheimer's disease and dementia. Mr. Meadows was a retired international airline pilot. His wife had developed dementia, and by the time she was 85 years old, the stress of having to take care of his wife took its toll, and he ended up in a sort of compassionate type killing. Killed his wife, and then he killed himself. And this is the tragic end that Alzheimer's disease can have on families. So let's talk about dementia and Alzheimer's disease. As of last year, there were around 6 million Americans that suffered from this disorder, and now that number has rose to 7.5 million. So in just 1 year alone, that number increased 1.5 million just here in the United States. This article here is from the Alzheimer's Association, which was published in 2021, and it stated that the number of cases are expected to triple by 2050. So if you actually read between the lines here, and what this article is saying is that they don't know the cause of the disorder, and medicine and the pharmaceutical industry has no cure or recourse for this. So the medical model of care has no answers. If they did, this problem would be getting smaller. I will argue that from a neurological review, and I will show you a few studies that we do know how to change the brain, and there has been studies that have actually shown reversal of cognitive decline and dementia. So the good news is that your brain is highly responsive to strategies that improve its health and function. If we look at this slide from Senior Living Research in 2021, you see that the current cost in the United States of living in a memory care facility is close to $7,000 per month. That's over $80,000 per year, and these numbers are expected to rise. According to the National Institutes of Health, individuals with dementia receive over $321,000 worth of care during the total course of their disease. Most of the total and net costs are borne by family members for informal care and out-of-pocket payments. So families will incur up to 70%, if not more, of the total cost, which is greater than $225,000. This will financially bankrupt most families. So I just want to reiterate that this no longer has to be your fate. The research is now clear if you're willing to take the right actions to make a change. Before we go any further, I just want to talk about a question that many people have, and that is, why isn't my doctor talking to me about this? And that is because most conventional healthcare providers do not know and are not trained to recognize the signs and symptoms of early or even late stages of brain degeneration, or what we know as dementia and Alzheimer's. Nor do they know how to develop treatment strategies to address it, and frankly have no incentive to do so. And let's be honest, when you have a 5-minute office visit with a healthcare provider, they will not have the time to evaluate you for cognitive decline. No matter how many doctors you see, signs of cognitive decline will likely be ignored, and you may just be told that it's normal, you're just getting older. Although it is becoming more and more common, having your brain degenerate and rotten away is not normal. The important thing is that you know you can stop cognitive decline right away if you do the right things. So the questions you have to ask yourself is, if you are noticing changes in yourself, how fast is it progressing? What are you doing about it? And is this something that you're starting to notice in other family members? So let's get into this. Neurological diseases are at record levels that have never been seen before in history. The top neurological disorders are headaches, dementia, strokes, multiple sclerosis, Parkinson's disease, and Alzheimer's disease itself. The top three disorders are occupied by the Alzheimer's, dementia, and Parkinson's disease. The important thing, according to JAMA, Journal of American Medical Association, is that they estimate 1 in every 6 of the world's population lives with some type of neurological disorder. These are the 4 early warning signs of cognitive decline. The first is loss of endurance. When the nerves in our brain start to slow down and malfunction, we start to lose endurance. We become fatigued very easily, and we don't have as much physical and mental energy and stamina that we used to. This is the first sign that there may be something going on. Then we begin to lose focus, attention, and concentration. And this becomes what is called as brain fog. Here is the reality. By the time you get brain fog, you may have already progressed into stage 3 of Alzheimer's disease. This is getting so bad here in America right now that, according to Recode 2.0, which is a group of medical professionals led by Dr. Dale Bredesen, they have brought back over 5,000 people from Alzheimer's disease, and they have recently published their findings. They state that every American over the age of 45 needs to be tested for cognitive decline. By doing this webinar, it is my intent to take the scientific data, break it down, and simplify it so that you can understand what I'm saying and hopefully apply it. Some of it may be technical, but I'll do my best to decode it so that you can get the most out of this information. To define dementia basically means loss of mind. Your brain literally will begin to shrink, which is seen on MRI scans. Think of your brain like a muscle. If you don't use it, it will shrink and atrophy. Same thing happens with your brain. If you don't use it and constantly challenge it, you begin to lose it. So please raise your hand. And I know we're over the internet, the virtual world here, but ask yourself, do you want to become a burden to your family? Do you want to have the problems associated with Alzheimer's disease? Forgetting where you are, who you are, where you're going, can't remember your family, your friends, needing help dressing, caring for yourself, like going to the bathroom, bathing yourself, feeding yourselves. These are the problems associated with end-stage Alzheimer's disease. The question you need to ask is, do you want to become a burden to your family? So please think about that as we go through this presentation. The term dementia is actually a syndrome. It is an umbrella term used to describe a range of symptoms associated with cognitive impairment. There are over 400 different types of dementia. Alzheimer's by far occupies the majority of the cases, up to 60 to 80% and growing. This is a study from Johns Hopkins University where it says early onset Alzheimer's disease begins before the age of 65. It says right here that Alzheimer's disease most commonly affects older adults, but it can also affect people as early as in their 30s and 40s. When this occurs, it is often misdiagnosed. And here's where the problem lies. If you went to your doctor and you tell them that you are having focus, attention, and concentration issues, that you walk into a room, you forget why you walk in there, and you're 65 years old, what do you think they're going to tell you? You're just getting older. What if you're under 65, like you're in your 30s and your 40s, and they tell you you're just getting older? That's not going to fly. You may be told that you're stressed out. You may be given a drug for anxiety or depression. And what's happening is they're totally missing the early stages of this disease, where they can have the most profound impact on making changes. I've seen in my office several times where a family member brings in their spouse, their parent, and they're told by their doctor that they were just diagnosed with dementia. I hate to be the one that has to tell them that they are actually in a late stage dementia and nothing can be done. They've waited too long. If it was recognized early enough, we could have had a profound impact on turning this around. So time is a major factor when dealing with brain decline. The longer you wait to do something, the less likely there is that anything can be done. I'm going to show you what you need to do to make modifications to slow this process down according to the scientific research and actually regenerate your brain, again, only if it's caught early enough. Our goal is to improve cognitive function. People that have normal, healthy, functioning brains have the ability to have short-term recall, long-term recall, organize and plan events, and multitask, as well as healthy ability for focus, attention, and concentration. What happens with dementia is that areas of the brain that control these particular functions begin to decrease and begin to atrophy. Many of the things we do in our daily lives can have a significant impact on how quickly our brains will degenerate. Now, this is important because this Alzheimer's problem that we have here in the United States, and this is where the truth is going to hurt a little bit, and the truth is that this is a self-inflicted wound. For most people, they have done this to themselves. There's 1% chance that genetics does play a part. So what this actually means is that 99% of the people that get this disorder is because of a self-inflicted wound that they created to themselves and something that they are totally unaware of. However, once we are aware of what these issues are, we have the choice to make a change and to take a different path. The self-inflicted wounds that I am referring to lie around our habits of diet, nutrition, and lifestyle. When we are not paying attention in these areas, we are opening the doors for Alzheimer's, dementias, and other chronic diseases. So please pay attention to what I'm about to say. Just a few improvements in the right areas of our lives can not only slow down the degenerative process, but even reverse and improve cognitive function. This one study will change your life if you follow what it says. This is one of several studies that are available. This one came out in 2016 and was published in the Journal of Prevention of Alzheimer's Disease. I bet not many people have heard about the groundbreaking information that it contains. Now, if there was a drug that did even half of what this study showed, it would likely revolutionize healthcare and it would be all over the news. So if you look at the study, you'll see that it was only 12 weeks. So within just 3 months, they had very profound effects noted. Out of a total of 127 people in this study, ages between 60 and 80 years old, with the average being around 70, all of these participants were diagnosed with mild cognitive impairment, and all of them had positive findings on MRIs that showed volume loss of their brain tissue, meaning their brain showed some degree of degeneration. They put these 127 patients through a 12-week dietary, lifestyle, brain-based therapy program, and just after 12 weeks alone, they retested 17 of them to see if they had any improvement. What this study showed was that out of the 17 that they tested, 12 of them had either no more atrophy noted in their brain compared to their original MRIs, and that the volume and size of the hippocampus, which is the area of the brain that is most affected by Alzheimer's disease, had actually grown in size. So the part of the brain that was shrinking actually grew in only a 12-week program. Just imagine if they continued with the study after 12 weeks. Overall, what they saw for the participants in this brain fitness program was that there was a significant improvement in cognitive function up to 84%. One of the other important realizations from the study was the fact that there were no drugs that were utilized. And currently, there are no drugs available that reverse Alzheimer's disease. As a matter of fact, there are several commonly prescribed prescription medications that will actually promote cognitive decline. This slide lists some of the top medications that impact brain function. You have this list available as part of the download, so you can look them up yourself on Google if you prefer. How do we know that there are no drugs that work for Alzheimer's disease? There has been well over 2,173 clinical trials that have been published as of 2019, And out of those trials, there have been none that have shown any success. There is one class drug that is out there that goes by several different names. However, all it does is allows one of the neurotransmitters to hang out in an area of the brain a little bit longer, providing a mild boost in cognition. It does absolutely nothing to rebuild your brain and comes with a long list of side effects. So why are there no drugs available? That is because when you're given a diagnosis of dementia or Alzheimer's, you are at an end-stage disease process, meaning you have to go through many stages before you're actually given that diagnosis. What we now know from the National Institutes of Health is that Alzheimer's is a multivariant condition. Well, what does that mean? It means that it is not caused by one single problem. There's multiple things that occur over a period of time that lead up to this disease. So if there is a multi-reason why someone gets this disease, how can a single drug that addresses one area have any effect? Well, it can't, and that is why a drug approach to address this disease has repeatedly failed so miserably. They have identified up to 39 different triggers that can actually cause the brain to degenerate. Let's use this roof as an analogy and say that there are 39 holes in the roof of this house. What if you call a repairman to come and fix your roof, but they only repair one of the 39 holes? What do you think is going to happen? If you said it's still going to leak, you'd be correct. And that is like taking one drug to try to patch and fix the 39 holes. It's not going to work. Again, this problem is a multivariant problem, and in order to fix it or slow it down, you have to use a multivariant approach. What that means is you have to take multiple actions and therapies at the same time, which is the way we address this in our clinic. In order to take this multivariant approach, you have to do this to stop the problem. It is my job to turn on your brain, and in order for me to do that, we have to figure out the primary triggers that have caused your brain to malfunction or degenerate in the first place. Think of it very similar to like a cell phone in that you have a very particular sequence of numbers you have to press in order to unlock that phone. Although the end-stage symptoms of dementia are very similar with everyone, everybody has their own unique code that is needed to be deciphered in order to unlock their phone. So in order to understand how those 39 holes in our roof will have an impact on our health, we have to understand a little bit about what is needed in order for a brain cell or nerve cell to be healthy. And what this diagram shows is that in order to maintain the health of these brain cells, we need on a regular basis the proper amounts of oxygen, the proper amounts of sugar, the right amount of stimulation in both mental and physical stimulation, as well as the proper amount of stress on the body on a regular basis. What happens is these things can be disrupted where the oxygen can be impaired by the amount of poor circulation brought on by things like anemia or even a lack of oxygen to the brain, such as with sleep apnea. Blood sugar dysregulation is huge. They call it dysglycemia, and can happen not only with type 2 diabetes, but people that are also hypoglycemia. They're not getting enough sugar to the brain. Lack of physical activity will affect the stimulation of the nerve. Inflammation and infection is huge. That will cause added amount of stress onto the cell, as well as autoimmune diseases. And in this country, this has skyrocketed over the last 50 years to the point where 1 in 5 Americans now suffer from some type of autoimmune disorder. And then we also have environmental toxins, which could be air pollution that we get not only outside, but majority of this actually comes from inside our home. And all of this accumulates to cause these 39 holes, which will slowly start to break down the health and the integrity of our nerve cells. I discuss all of these key areas of health in my recently published book, except for number 8 on hormonal imbalances. Identifying and eliminating the triggers in these key areas is how I approach a patient in my office. I like to refer to it as untangling your unique neurometabolic web of dysfunction. And everybody's web of dysfunction is unique to them, just like the code you use to unlock your cell phone. Time is of the essence. I want to stress that time is of the essence when dealing with Alzheimer's and dementia. We don't have this window of time where we can just sit around thinking that there may be something wrong. And we can't afford to listen to doctors that tell us to come back in a year to see if anything has changed. Once the brain starts to decline, it has a snowball effect in which it starts to progress and accelerate. Just to be aware, there's 3 important milestones when dealing with cognitive decline. First, it starts with subjective cognitive decline, where you are usually aware that something is going wrong. Like you notice you're having difficulty with focus, attention, and concentration. Then you progress to the point where you develop what's called mild cognitive impairment, where this becomes worse and more frequent, and now other people are beginning to take notice. Then you have full-blown dementia, which is, again, the end game we talked about and unlikely coming back from. I'd like you to take a look at the 7 stages of Alzheimer's, and with your pen, if you've downloaded the slides, I'd like you to draw a line right down the center of the page so that stages 1 through 4 are on the right hand side and stages 5 through 7 are on the left. If you are on the right hand side of this line, this is where we can do not only slow down your decline, but we can also reverse it and change your life forever. At stage 1, we don't really have an impairment and you're not aware of any issues at this point. However, at stage 2, you are starting to experience this focus, attention, and concentration issues that we talk about. And this is what's called the subjective cognitive decline that I mentioned in the previous slide. Now you're starting to understand or realize that there is a problem. You start to progress into stage 3, and this is where you notice you're walking into a room and forget why you walked in there. You keep losing where you put your keys. When people call you on the phone, you forget what you're talking about. Or you get into conversation with somebody face to face and you forget what you're talking about. When this starts to occur on a daily basis and other people have started to notice, you've progressed from stage 3 into stage 4. When you move from stage 4 to stage 5, now you begin to have lost so much brain function that you no longer see yourself as a problem. However, everybody else you think has the problem. You stop taking care of yourself and letting your personal habits go. And this is where everybody really starts to realize that there's a problem and they can no longer deny it. As you progress in stage 5, you start to decline rapidly. When you begin to lose your bowel and bladder habits, you progress to stage 6, and this is where you're headed. This will continue to progress until you can no longer feed yourself and you're totally dependent on other people taking care of you. You have lost all independence and you don't know where you are or the life that you had. When you've progressed to stage 7, at this point, most people will live in this vegetative state for an additional 2.5 to 3 years, excuse me. Remember when I asked you to raise your hands if you wanted to become a burden to your family? Well, if you know you're developing this cognitive decline and you recognize that you're in stages either 2 through 4, and now you know what this progression is, the Alzheimer's Association has already plotted this course, then don't become a burden to your family because you know where this is heading. Cognitive decline will begin to impact the entire family, especially when everyone starts to come to terms with its reality. Many will go through a period of denial with a family member during the early onset of this disease, and this delay can be critical for recovery. I just want to reiterate that it does not have to be this way. Our brains have 3 building blocks that repair, restore, and regenerate itself. This information right here, although a little technical, can actually change your life. The brain has the ability of what is known as neurogenesis. What does that mean? Neurogenesis literally means nerve creation. We actually have 2 areas of the brain that can actually produce stem cells, and I believe there are some more areas that are being found, but no science has been published yet. Now, I know we've been told in the past that once our brains have been damaged or the nerves in the brain have been destroyed, we would never be able to regenerate them. The amount of neurons that we're born with is all that we're ever going to get. That's what we were told. However, the new research tells us that that is not true at all. Your brain actually has the ability to regenerate itself in two areas. One of the areas is known as the hippocampus, and it just so happens that the hippocampus is the main area of the brain where long-term memory is stored. Alzheimer's impacts this area the most. So the research now shows that this area is the same that has the most stem cells and the ability to regenerate if you do the right things to stimulate it. The other aspect of the brain that has revolutionized the science world is that the brain has what is called brain-derived neurotrophic factors, also known as BDNF. These are like specific nutrients which stimulates nerves to grow. When they do that, they can actually grow branches out just like what you would see like the roots of a tree. As these new branches reach out and touch other nerves and begin to make new connections with them and begin to communicate with them more efficiently. It is this new connectivity that is known as neuroplasticity that actually wakes up our brains and brings our brains back online and improves our cognitive function. If we think about these neural stem cells, just like seeds that you plant in the ground, what do? You add nutrients in it in the form of a Miracle-Gro. That would be similar to this brain-derived neurotrophic factor I just talked about. Then you nurture it. How do you do that? You stimulate it with things like sunlight, and that would be akin to the specific therapies or exercises that you would do, and it begins to grow. It starts to grow these roots and branches out in all directions, touching and communicating with other nerves in the area, and that is what we call neuroplasticity. This brings our brains back online and improves the ability to function and regrow. Here is just another study that was published in 1998 in the Journal of Nature Medicine. Quote, our study further indicates that the human hippocampus retains the ability to generate neurons throughout life, unquote. Not till age 80, but throughout life. The key takeaway here is that we do have the ability to generate new nerve cells and make changes to the brain and enhance the way the nerves connect to and communicate with each other throughout life. We need to have more nerve creativity, more nerve growth factors, stimulation, and neuroplasticity than the amount of neurodegeneration taking place. We need to tip the scales in our favor in order to have a healthy brain. The more of those 39 holes you have, the more brain degeneration will take place and eventually override your neuroplasticity, tipping the scale in a negative direction. These things impact brain function and are right out of the National Institutes of Health. 1. Lifestyle factors. Things like stress, relationship stress, sleeping habits, hygiene. A big one with hygiene is both oral and dental hygiene, something that is often overlooked. 2. Physical activity. This is how you stimulate your brain. There is no drug on the planet that will stimulate your brain in order for it to activate those neural stem cells and create neuroplasticities. You must be physically and mentally active. Couch surfing and having a sedentary lifestyle does not work. Diet. What you eat and how you eat it is either going to give you what you need to heal or slowly tear your body apart. Unfortunately, most Americans are doing the latter. Prescription and over-the-counter medications that you consume. We already talked about these drugs, which will accelerate or cause cognitive decline. And there's alcohol abuse. These are the 5 major factors that drive you into Alzheimer's disease. Most people are unaware that the Western diet increases risks for Alzheimer's disease. Most of us have never heard this information before, and we are definitely not going to hear it from a medical doctor. But what we eat can lead to neurological decline and disease. Here is the perfect diet if you want Alzheimer's disease. This is what you need to eat. 1. Modern wheat. Flour, bread, pasta, and virtually any processed food out there. If you Google wheat and you see its association with Alzheimer's disease and other neurological disorders, you may be surprised at what comes up. The wheat that we eat nowadays is not the same wheat in this country prior to the mid-1980s. It has been hybridized and turned into a protein that the majority of us cannot digest. It creates an immune response that slowly attacks your brain and your nervous system as well as other parts of your body. You don't have to have a digestive issue to think that you have a problem with wheat or gluten, because the majority of the time it is affecting your central nervous system. 2. Sugary drinks, diet sodas, sweet teas, and artificial sweeteners in a lot of these sports drinks as well. 3. Refined carbohydrates like potato chips, crackers, cookies, pretty much everything they serve you when you're on an airplane these days. Number 4. Trans fatty acids. Anything that has the word trans in it is not good for you, such as fried food, French fries, margarine. Other processed foods, if you frequently eating these things that are packaged or out of a box, or constantly eating fast food restaurants, you're highly prone to developing dementia. Artificial sweeteners. These things are like sweet and low, aspartame, and again are often found in a lot of these sport-related drinks, which are loaded with these neurotoxins, as well as excessive alcohol. Now, I've been guilty of consuming some of these things throughout my life as well. I'm not pointing fingers here. The thing is that you may get away with the negative impacts of some of these from time to time, but eventually it will catch up with you. Many Americans are consuming these on a regular basis, so it is no wonder that the incidence of Alzheimer's disease and dementia has increased 1.5 million in a single year. Now, how do all these factors negatively affect the brain? And that comes down to one word: inflammation. And when inflammation starts to affect the brain, it is called neuroinflammation. So, what happens to the brain when it becomes inflamed? Not to get into too much detail here, but we have these cells in the brain that are called glial cells. These right here are what's known as glial cells. And they have the ability to move throughout the brain by these projections that come off. They're kind of like legs that allow these things to move around the brain tissue. Current research has shown how metabolically active these cells are, where before they were thought to just be glue that was holding the brain together. Now, the main thing that they do around your brain is they scavenge up debris. They're more active at night, which is why having a good night's rest, a good sleepful rhythms is so important. These glial cells can migrate around your brain when you're sleeping, scavenging, engulfing, digestion, not only byproducts of your own metabolism, but any type of bacteria, virus, or any type of infection or chemicals that may get into the brain. There can also be a lot of waste product buildup and debris from people that have experienced any type of head trauma, concussion from car accidents, whiplash type injuries, sports related injuries. And if these cells are working properly and there is no neuroinflammation, this will easily clean up the brain debris and you won't get buildup of all of these factors in the brain. If you can think of these glial cells very much like a lapdog in your kitchen, it's in there at night while you're sleeping, licking up all the food and debris that may have dropped onto the floor. And that's what a healthy glial cell activity should be similar to. Now, what happens when the brain becomes inflamed from all the things that we talked about earlier? These glial cells, they lose their legs and they convert from this M0 state into this M1 state. Now, when this occurs, they are known as primed glial cells. They start spewing off a lot of inflammatory markers, and they lose their ability to move about the brain in their scavenging effect. They start becoming like these very angry territorial chihuahuas. Look at that mellow lap dog that was moving about your floor, cleaning up all the debris. Now turning into Taco here, which is this angry type chihuahua.
You had enough.
Has lost its ability to move around, and now it becomes very angry and territorial.
Relax.
This is what happens when your glial cells become inflamed. So when the glial cell loses its ability to migrate about the brain and it's starting to spew off inflammatory markers, it loses its ability to have that clearing mechanism. And what begins to happen is you start getting the buildup of these sticky proteins, often known as tau protein and amyloid plaque buildup. And these protein buildups are often associated with Alzheimer's disease. When you hear people talking about them, that's basically what's happening. The brain loses its clearing mechanisms and can no longer clear out the debris. It starts to clump, and it can't get circulated out. So any treatment goal that we would do would be to calm down the neuroinflammation in the body, figuring out what those triggers are that are causing that, and work on converting this M1 state to an M2 state where, although it won't be as effective as it was originally, it will have the ability to create some degree of debris clearance, but it will also stop producing its own inflammatory markers. And this is a primary treatment strategy that we utilize, is to convert these M1 glial cells to an M2 glial cell, so it will start the cleaning process in the brain. And this is a term that you may have heard before. It is called autophagy, which basically means automatic eating. And that's the situation that we want to create with people's brains that have degenerated in order to bring them back online. So to recap, the first signs of dementia and Alzheimer's is loss of focus, tension, and concentration, which is what we call brain fog. The medical model will typically not take these signs seriously and blow it off and tell you that you're just getting older. But these are the first signs of early onset Alzheimer's and dementia. In fact, there are a few other symptoms associated with brain fog, such as insomnia, anxiety, and depression. And if you're placed on an anti-anxiety medication, it may be just masking something more serious that is developing. In the early stages of this disorder is where we have the potential for the greatest recovery. By treating it in the early stages, it's taken a very proactive approach as opposed to waiting until you're in stage 5, and now you have to be reactive to the disease. Unfortunately, this is how our current healthcare model is. They take a reactive approach to addressing chronic disorders, which has been proven to fail time and time again. Within the last decade, the life expectancy here in the United States has declined 3.5 years. With the hefty price we pay for health insurance, it is supposed to include examinations, special tests, and procedures to catch early disease. The fact that our life expectancy has shortened in the last 10 years is an indication that the system and model doesn't work and has failed. I can't emphasize this enough, that time is of the essence when dealing with this disorder. Everybody will progress at a different rate from stages 1 to 5, depending on how healthy you are and how many of those 39 holes that you may have in your roof. It could be months or even years when going through the initial stages of this disorder. So it is my goal to determine what your unique neurometabolic web of dysfunction is so that we can customize a personalized treatment plan for you. What we do is use very specific neurological and metabolic questionnaires that will help us determine possible areas of dysfunction, as well as review of any previous labs or imaging studies that may have been performed. Our office is also a certified site that can administer what is known as the Montreal Cognitive Assessment Test, also known as the MoCA test, which is a cognitive screening tool designed to assist healthcare professionals in the detection of mild cognitive impairment and Alzheimer's disease. I will also perform a detailed case history, functional, neurological examination, and will order any appropriate laboratory work that I feel is necessary. We have our own blood draw center in our clinic, so I don't have to refer you out for this, and I use only the top reputable labs in the country. So let me ask you this question. If you knew you were going to get terminal cancer, but there was a test that you could do that told you what was wrong 20 years before you were diagnosed, which gave you the opportunity to fix the problem, would you run that test? What if I told you there was such a test that predicts the likelihood of you developing Alzheimer's or dementia 20 years in advance? Cyrex Labs is one of the top immunological labs in this country, and they have such a test called the ALZHEIMER'S Links profile. This lab test, which is one we frequently run in our office, can actually pick up on those 39 holes that drives this disease years in advance. By running this test, you are doing one of the most proactive forms of testing you can do for your future health and wellness and prevention of a devastating disease. This is what this lab looks like, and this is one of our female patients in her late 40s with symptoms of cognitive decline already. Anything marked in the yellow or red is a positive finding. What do you think would happen to this person if they ignore these? What do you do at this point? If any of this information hit home with you and you would like to determine if you're a candidate for care in this office, I'd recommend that you go to the bottom of this presentation and click the link below where it says download forms. You'll be able to print or digitally complete the questionnaires that I talked about. Send them back to our office along with any copies of any lab work or any imaging studies that you've had done so that I can review them, and I will determine if you are a candidate for care in this office. At that point, we'll need to set up an appointment where a detailed history, physical, and neurological examination can be performed. From that point, I will determine if any additional labs or imaging is necessary. If I feel I can help you, my goal is to get your life back. I will put together a personalized plan which will be given to address your own unique neurometabolic needs. Just to review some of the major key concepts we talked about. Currently, there are 6 million Americans that suffer from dementia. That number will triple in the next 30 years, and in the past year alone, this number has already increased 1.5 million. Medicine has nothing to offer this disorder. There are no drug options available. Some of the drugs may make your problem worse. Once you have progressed to stage 5, there is very little chance of recovery. Unfortunately, you may never get an accurate diagnosis until stage 5. By then, it may be too late. If your family cannot care for you or they do not want to take on your burden, you may be placed in an assisted living facility if one is available and you can afford the care that you need. If you suffer from Alzheimer's or dementia, the average cost for a memory care facility in the United States is almost $7,000 per month. That's over $83,000 per year. And according to the National Institutes of Health, families will bear a minimum of $225,000 after insurance coverage. And those costs are projected to rise. You are now aware of some of the current research available on Alzheimer's and dementia. You likely know more information than many healthcare providers available. You do not have to suffer the same fate as Mr. Meadows. However, if you're in the early stages of cognitive decline, you need to take action before it's too late. I want to thank you for attending this webinar and hope you found this information profound and you're able to make good use of the information. Here's my contact information, so please don't hesitate to reach out to me if you have any questions. Thank you for watching.